Hello, great people. It's another time. It's Tuesday. It's 7:30 p.m. and we are on Focus on Health. And this is a show, as I always say, that it's a show that empowers you and educates you about your health. During our past episode, we were talking about cervical cancer. And if you remember, I told you that we'll be talking about cancer for the next 3 episodes. And today, we'll be talking about breast cancer. I know all of us have one way in one way or another related to the breast. It is what you used to suckle from when you were young. And today we'll be joined by Dr. Macharia. Thank you very much, Dr. How have you been?
Thank you very much.
It's been a week.
It's been a week.
Yes.
I'm doing well.
I'm also well.
Okay.
Today we are talking about breast cancer. Yeah, and I know all of us, just as I mentioned, all of us in one way or another have related or have acted to with the breast, and then we have the cancer. Tell us, what is breast cancer?
Good. Breast cancer is basically a cancer. It's cancer of the breast affecting tissues of the breast, which could be the lobules. Lobules is what manufactures the milk, the tissues that manufacture the milk, or it can affect the ducts. The duct is the piping that carries the milk. So basically the lobules produce the milk. And that cancer is called lobular carcinoma of the breast, or the ducts that carry the milk towards the nipple. They are called ducts, and that's ductal carcinoma. So any cancer affecting any of those 2 tissues is cancer of the breast.
You've been in this field for over 20 years and you have so much experience. In your time in this particular field, how common is breast cancer in Kenya right now?
Breast cancer is very common in Kenya. And actually the rate of breast cancer in Kenya has gone up. Experts are still wondering, is it that we are having more new cancer cases, or is it that we are getting more advanced in diagnosing these cancers?
Oh, yes.
But in hospital setups, we are getting very many cancer cases, unfortunately at a very advanced stage.
And what can you attribute to this?
When the advanced stage of the cancer, or the new cases of the cancer?
Oh, the new cases of cancer first, before we get to the advanced stage.
The new cancer cases of cancer, I think with the lifestyle change, there could be a contributing factor to these cases of cancer. 2, as I said, also with diagnostic improvement and advancement in diagnostics, then that also will make us detect those cancers early enough. Therefore, we'll be able to get an uprise in cases of this breast cancer.
Do we have types of breast cancer, or we have stages? Of course, we have stages, stage 1, 2, and 3. Do we have any types of breast cancer that are specific to a region of the breast?
Yes, that's what I mentioned as early when we starting this program, is that I said we have 2 types.
Oh, 2 types.
We have the ductal carcinoma, or ductal cancer of the breast, affecting the ducts of the breast, and we have the lobular carcinoma, affecting the lobules of the breast.
It skipped me, and I hope now our viewers can now be able to, although they're very jargons, very big terms, but I hope you've also tried to break them down. But also, now, what are the symptoms of breast cancer?
Very good. I'll try to demystify everything, and I'll try to be very simple as much as possible so that it can benefit every listener and viewer. The earliest symptom of breast cancer is a small or a painless lump in the breast. Yes.
That's the
basic. It's painless. It's a painless lump in the breast. That is the earliest sign of breast cancer.
What about change in size or change in size or shape of the breast? Can we also attribute that to also one of the symptoms? Or as one grows older, then the shape is bound to change?
Yes, of course. One would say the change in texture, I would call it texture of breast, is a late sign in breast cancer. As I said, the earliest sign is a painless lump. But of course, if you have change in texture of the breast, you can have skin changes. You've seen the peel of an orange.
Yes.
If you get that kind of texture on the skin with
Roughish,
an associated, yes, and looks like it has holes. That's how an orange looks, the peel of an orange. It's called peau d'orange. That is French. If you have that with an associated breast lump, then more often than not, you're dealing with breast of the cancer. If you have the nipple retracted, the nipple is supposed to protrude outside.
Inverted.
If it's inverted or retracted for that matter, that is a danger sign. It's a sign of breast of the
So
cancer.
instead of the nipple coming out, then the nipple in fact goes inwards.
It goes in.
Yeah.
In an initially protruded
protruded,
nipple,
yeah.
then suddenly you have a lump and the nipple has gotten sucked back. Then that is a sign of breast cancer. Yes.
What about the reddening of the skin?
The reddening of skin cannot be, it's not really 100% because reddening in medicine we say is due to inflammation. When you have a boil, the skin gets red and very painful. So when you have a painful lump in the initial stages, what it means is that this is more of inflammation, which is a better sign than when it is painless. So the reddening really, unless it is in a very advanced breast cancer, whereby the tumor is threatening to burst out of the skin, then you will have reddening at that particular time.
What about peeling, or rather called the areola?
The peeling of the areola.
Yeah.
The peeling of the areola basically is not a cardinal sign for breast cancer. You and me know that when babies breastfeed, they sometimes, because the mothers get the peeling of the areola region,
Yes.
because of exfoliation of the skin, because the baby is just trying to breathe, and sometimes they get cracked for that matter. So that is not a cardinal sign.
For our friends back at home, maybe it will be of interest to just know what an areola is.
An areola is the black part surrounding the nipple.
Yes, the black parts.
The black part surrounding the nipple.
Is it for everyone, or that's for an African setup, black parts?
It is for everyone, yes. And it is associated with a certain particular kinds of glands that secretes, that cause some secretion. So yes.
Yeah.
Yes.
So what are some of the causes of breast cancer? It's really an interesting conversation today of breast cancer.
Okay.
Yeah, causes of breast
Causes of breast cancer. One, there's genetic. There's a certain gene type, but they don't want to be very complex. It's called BR something, BRC3, BRC4 is associated with breast cancer.
Yes.
Such that if you have that gene, chances are almost always you will get breast cancer. There's one of the super pop star who had preventive or prophylaxis removal, excision of the breast cancer because the sibling had the same gene. Okay, number two, age. Breast cancer, chances of breast cancer increase with age. Number three, another risk factor, family history. A strong family history of breast cancer is a risk factor. Number four, there is smoking.
Smoking.
Smoking is also a risk factor. Okay. And number five is what we call early menarche and late menopause. What do I mean? Early menarche is when this girl starts receiving her periods or menses. So early, they receive early, and the late menopause. It means this patient has, this particular person has a prolonged reproductive period.
Yes, of course.
And a prolonged reproductive period goes hand in hand with prolonged hormone estrogen levels.
Estrogen levels. In the body, yes.
So estrogen levels, or estrogen supplementation is a risk factor. Early menarche and late menopause is a risk factor based on the fact that you're exposed to estrogen for a longer period of time.
Thank you very much, Dictionary. I'll need you to just take a very short pause there, but we're now going to take a very short commercial break. But when we come back, we're going to talk about the relationship between all these things and whether men are also at a risk of getting breast cancer. Don't touch that dial. See you on the other side, and we'll leave you with the Did You Know segment.
Symptoms of breast cancer. The symptoms of breast cancer include lump or thickening in or near the breast or in the underarm that persists through the menstrual cycle, a mass or lump which may feel as small as a pea, a change in the size, shape, or contour of the breast, a blood-stained or clear fluid discharge from the nipple, A change in the feel or appearance of the skin on the breast or nipple. Redness of the skin on the breast or nipple. A change in shape or position of the nipple. An area that is distinctly different from any other area on either breast. A marble-like hardened area under the skin. 5 ways to prevent breast cancer. Number 1. Keep weight in check. Maintaining a healthy weight is an important goal for everyone. Being overweight can increase the risk of many different cancers, including breast cancer, especially after menopause. 2. Be physically active. Exercise is as close to a silver bullet for good health as there is, and women who are physically active for at least 30 minutes a day have a lower risk of breast cancer. Regular exercise is also one of the best ways to help keep weight in check. 3. Eat your fruits and vegetables and avoid too much alcohol. A healthy diet can help lower the risk of breast cancer. Try to eat a lot of fruits and vegetables and keep alcohol at moderate levels or lower. 4. Don't smoke. Smokers and non-smokers alike know how unhealthy smoking is. On top of lowering quality of life and increasing the risk of heart disease, stroke, and at least 15 cancers, including breast cancer, it also causes smelly breath, bad breath, and wrinkles. Now, that's motivation to stay smoke-free or work to get smoke-free. 5. Breastfeed if possible. Breastfeeding for a total of 1 year or more combined for all children lowers the risk of breast cancer. It also has great health benefits for the child.